Well, I was truly fascinated from the very first moment with the experience, with the epigenetic studies, because the patient, when we meet and I explain their results, tells me it's as if you're reading me, as if you know exactly who I am. Because precisely one of the most significant impacts I've observed in patient profiles is how much the emotional aspect influences everything. A person can appear very healthy on the surface, but they can be getting sick simply due to the stress they are exposed to, poor sleep quality, and factors that have to do not so much with health, but with the mental or emotional sphere or the realm of emotions precisely. So that's one of the things that really caught my attention. I really love talking about this with patients because patients are more aware of how their emotions can make them ill, because some people just don't give importance to that. For many people, health is simply a combination of good nutrition, good rest, and a good lifestyle or doing exercise. And it completely ignores the sphere of emotions, which is so connected to the fact that they can also make us ill. And in fact, it's proven today that anguish, that anxiety, depression are very much related to many illnesses nowadays, right? So we discuss that a lot with patients. Another thing that really catches my attention about epigenetics, which isn't known much beyond a basic issue today, is the impact, unfortunately, of everything related to technology. While it benefits us greatly on one hand, it can also make us sick on the other. And it has to do with the excessive radiation we're exposed to, especially from a very young age, because children are constantly on tablets, computers, and so on. And I love talking to patients about the importance of detoxing ourselves a little bit also from the currents, from the technologies, from the frequencies, because it's like getting in touch with ourselves, with what nature truly is, right? Because human beings today are practically pure current, pure electricity. Sabi niyo ko, to seek a little of what we always talked about in the past, grounding ourselves, disconnecting a bit, practicing good sleep hygiene so that our technological life doesn't affect us so much, right? And those are some of the experiences and some of the little things that I was noticing. And that's all, of course, but then not to forget that when we optimize supplementation, nutrition, we realize the patient comes to the clinic very happy and says, I don't want to stop this anymore. I feel so good that I feel good taking these vitamins, minerals, antioxidants, amino acids, and I'm in balance. I feel complete. I rest better. I have more energy. So these are all truly very rewarding experiences I'm having in this field because I see, of course, through the patients. And it's what I always say in nutrition or in this field of work. It's so rewarding to see that the patient, they feel good, satisfied, grateful, and content. Of course, they return because they're comfortable with our recommendations. And of course, thanks to these tools we're using.
Fantastic. So lastly, to finish up, Dr. Carolina, if any health professional is watching, what would you recommend about epigenetic technology? Would you encourage them to use it in their practice? From your own experience, what advice would you give us? I believe that today it is almost a fundamental tool for any health professional.
I'm not just talking about my field of nutrition, but doctors, any professional who works with patients, having this information is truly invaluable for better prescribing, treatment, supplementation, so as not to be so limited in our approach. Which, I mean, well, when medication is needed, there's nothing we can discuss about it. But the patient who doesn't want to take it today, nowadays, so much medication you can find through epigenetics, through proper supplementation and good nutrition, many tools to improve your quality of life and health and not directly fall into what we discussed. Well, for this symptom, I already have this solution, but there's a vision, which in this case would be some drug, right? I think that by returning to our foundations, understanding ourselves more, using epigenetics as a valuable tool for our patients, we could achieve exceptional changes. And truly, in my experience, I found that, and I'm so happy. And I encourage health professionals who don't yet know this technology or about epigenetics to learn more, to investigate. Because for me, it's the future, it's the present and the future. Because today we're already discussing the present. But for those unfamiliar, they need to understand that these are tools that will bring him closer to what is preventive medicine specifically, so the patient doesn't require other types of more invasive treatments, but can use nutrition, supplementation, and lifestyle as preventive medicine precisely.